start with a brief introduction of yourself and then just give us an overview of the clinic facilities here.
Okay.
And then maybe once you're done, we go into the malaria treatment and overview of malaria prevalence within these prisons.
Okay.
Go for it. So
DSP Dr. Lawrence Kofi Champong, the medical superintendent of the Nsawam Medium Security Prison Clinic. The clinic used to be an infirmary, but now it has been upgraded to a clinic status, with the staff and the human resource capacity also going up. In terms of the services that we render, we have our clinical services, our normal OPD services that we provide. We have our pharmacy service, where we have dispensary technicians who are in charge of the pharmacy. We have a full-fledged laboratory in operation that runs almost all the basic labs that you can think of. We have also a cohort of nurses ranging from general nurses, midwives, psychiatric nurses, and other specialties in nursing. There is also a medical store that we keep our drugs and make sure that they are procured, and as we can all bear, most of the drugs are also donated drugs. There is also a theater facility where we also do minor surgical cases such as hernias, lipomas, and other swellings as well. The clinic is having a standard 5-ward, 50-bed capacity that we admit inmates in it and treat them, and when they are fine, we discharge them. There is both general cases in terms of medical cases, psychiatric cases, and other skin-related and other geriatric cases as well. Currently, the clinic doesn't take care of only the inmates, but it also provides services for the officers and their dependents as well.
So let's zero in now to malaria. What has been the general prevalence of malaria in terms of, if you have the statistics, and then the progressive effects of malaria, and has there been any deaths recorded through malaria?
Malaria, especially in Nsawam Medium Security Prison, is something that the authorities and the administration, as well as the management of the clinic, has taken it as something we have to look at, because throughout the nation is something that is being considered as one of the things that were causing a lot of morbidity and mortality. But when you come to the prisons, especially in the Nsawam Medium Security Prisons, the clinic, in conjunction with the administration, has rolled out a lot of programs. Such programs are public health campaigns in the blocks to educate the inmates. You know, we have a lot of risk factors in the prisons in terms of the congestion. The overcrowding nature of it makes the disease burden, can even cause complications and other sort of effect. Looking at our environment, we have a vast of land that is vegetation in nature. So you can imagine, if we are in the rainy season, we can also experience a lot of growth in terms of the weeds, which can also serve as a breeding site for the malaria, the mosquitoes, as well as the malaria parasite. Looking at the congestion, you can imagine where people will keep their buckets, people will fetch water because they have to drink. Some of them might be under their beds. These are some of the things that we embarked on to make sure that all these things are brought down, so that we decrease the breeding sites for the mosquitoes, so that we don't have them having the malaria. So there is a preventive healthcare team here that goes there to make sure we educate them. If, for instance, last month, in the month of July, we had about 200 cases of malaria cases. All of them were tested with the rapid diagnostic test, that's the RDT, and as well as Some of them were tested with microscopy. And out of that, we had over 85% of them being positive. And most of the cases, I would say about 70% out of the total that were positive were uncomplicated malaria. So they were managed with the normal ACTs. The rest that were complicated were also seen earlier because of the public health campaign that we have been doing at the blocks. So we have public health teams in the blocks who make sure that any inmates who fall sick or anything, they brought the patient to the hospital and we test them. So in this case, we are able to diagnose the case early and we start the appropriate treatment for them. So far we have not had any mortality with respect to malaria, and we have not had any major complication as a result of severe malaria as well.
Now let's talk about Agamal's spraying. I mean, with the current statistics you've just stated, I mean, what do you envisage will be the effect of such an exercise to spray the walls, as it were, with the active lethal chemicals as they were?
I think it is something that has come timely, and we actually will thank the Agamal for bringing this to the prisons, because looking at the statistics I gave, we realized that we had an increase in malaria cases as at the last 3 months. And doing mass spraying with the chemical is actually something that is an intervention that will go a long way to limit the disease burden in terms of malaria. So coming to spray will actually be a huge relief for us as clinician, myself as a clinician, and also for administration, because already administration are making plans of doing the mass spraying. So this has come timely to help us to curb the disease burden of malaria.